Welcome to our facial plastics clinic. We're conveniently located at the UCSF Mount Zion campus. We're on the first floor and patients have a private parking lot for their ease of access. We're actually one of the first doors through the main entrance. We have a comfortable waiting room for patients where they have access to coffee and refreshments. They're able to buy product lines. Our front staff greets the patients and checks them in at the front desk. Looking down the hall, we have two workrooms for nurse and MA first, and then on the left is a workroom for practice coordinators. On the right, we have a dirty utility room along with a patient restroom and additional computers for workspace for fellows and residents. Further walking down the hall, our first room on the left is our photo and consultation room. It's equipped with 3D cameras along with 2D regular cameras, large flashes, a large viewing screen for patients, and a color printer to print out morphs. The next room on the left is a examination room that's fully equipped and quite comfortable for the patient along with additional visitors. Directly across from this we have another exam room which is larger. This doubles as a procedure room for us and is equipped with our laser systems, an overhead operating room light, and platelet-rich plasma machine as well. These are currently not in the room due to COVID restrictions. This room provides a large space in order to provide rooms to perform procedures. The next room, walking back towards the waiting room, is a physician workroom where we have a couple of computers. We're able to get the majority of our work done during the day during a clinical visit. Overall, our patients are able to enjoy a comfortable setting and we have a great work environment there. One of our greatest assets are the people who work with us. We'd like to give them an opportunity to say hi to you, just as if they would do if you were visiting us.
Hi, my name's Ann Jensen. I'm a nurse in the clinic. I've been with facial plastics for about 2 years. It's a great place to work. We have a lot of fun, work hard, take care of our patients, and welcome for the interview. Sorry we couldn't meet in person.
Hi, my name is Brianna. I'm a medical assistant at Facial Plastics. I've been with them for about a year, and in terms of working with the fellows, I generally room the patients, give you a short synopsis of how the patient's doing, and if you need to find any materials in the office, I am usually your go-to person.
Hi, my name is Hannah. I'm one of the coordinators here at UCSF Facial Plastics. I've been with the clinic for about 5 years now and do just about everything administrative that you can think of. I have supported all of our doctors at one point or another, and I look forward to meeting you.
Hello, my name is Gerardo Ortega. I am the practice supervisor of Facial Plastics. I have been with the clinic for about 1.5 years and have been with UCSF for a little over 2 years. I currently oversee the clinic and all administrative aspects related to the clinic as well.
Let's give you a tour of the operating rooms at Mount Zion. If you come outside of our clinic, you'll see this building. This is our actual otolaryngology office, which is as well across the street. The Mount Zion is a standalone surgery center where patients can stay even for a couple of days or overnight. If we were to walk up to the 3rd floor by the stairs or the elevator, we would see this, the main entrance to the operating room. The Mount Zion operating room is where we primarily do facial plastics related operations, which excludes pretty much everything except for free flaps. Mount Zion for us is known for its friendly staff and well equipped operating rooms. Pretty much everything is very well set up for us here. It's kind of just walk in and operate without much stress. We operate with our residents here and our fellows here, and it's pretty standard, very well maintained facility, which is great to work at and be a part of. As you can see, the rooms are spacious. Our staff are excellent here and really take care of us. There's a nice waiting room for patients where we can go out and chat to family members during non-COVID times, of course. And right down the hall is the post-anesthesia care unit. Patients recover here and either just go home from here, or get admitted. The nurses here go over post-operative instructions with the patients as well. That concludes our tour of the Mount Zion campus. So let's move on now to the Mission Bay campus.
So here we are at the UCSF Mission Bay Cancer Center Hospital. This is where we do many of our more complicated reconstructions. It's a beautiful state-of-the-art facility, only 3 years or 4 years old. It is the flagship of our Mission Bay campus, which is basically a 16-block square area of research laboratories, office space, clinics, and hospital. From here you can see downtown San Francisco in the distance, just outside of Mission Bay.
The Mission Bay campus consists of a women and children's hospital and a cancer center. Half of that is clinic space and half of it is inpatient and operating room space. If you take the elevators to the 5th floor, you end up in our head and neck cancer waiting room. This is shared with head and neck oncology and surgical oncology and surgical reconstructive surgery of the head and neck. As you can see, there's lots of check-in desks and a self-check-in area, along with comfortable seating and refreshments for our reconstructive patients. One of the great things about Mission Bay are the beautiful views. Looking right outside of the building, you can see the Chase Center, which is where the Warriors play. And the bay is right outside of there, and a beautiful day it is today that we're filming. Right there is Mission Hall, where the academic offices are for ourselves, along with a desk for our fellow. Patients are greeted by our friendly MAs, and they're guided into one of our exam rooms. As these are head and neck exam rooms, they're well equipped to do anything and everything one would need for a reconstructive patient's examination, including scopes, ultrasound. The patient can even see their own scope on the television screen. All in all, a comfortable room that's brand new in this building that was just created. We have a big workroom as well. We have a couple of PAs who help us in the clinic, along with an inpatient PA who helps with head and neck patients and reconstructive patients. If we were to just walk down the hallway from the clinics, we would get to the inpatient hospital. Here is one of the inpatient hospital rooms. You can see they're all single occupancy. Big TV that's interactive. Patients can order their meals and obtain teaching all through their video screen. The views, again, from some of these rooms are spectacular. There's a beautiful view of the Bay and other Mission Bay UCSF buildings in the distance. That's the new ophthalmology building being built for family members. There's comfortable facilities and waiting rooms, even a meditation room for them to be at. This really helps heighten our patient satisfaction and also makes it a really nice place to work. Going to the 2nd floor, this is the preoperative area, and this is where we check patients in, a little work hub room there. And walking down the hall a little bit further, you get to the main operating room hallway. We have individual service workrooms on the right there, and the main control desk in the distance. We have great staff who work with us, especially when it comes to micro cases. You really need a dedicated staff who knows what they're doing and works quickly and anticipates what you need. Here's our head and neck fellow and chief resident in setting a free flap, and Dr. Park working on a case as well. Our current fellow Karam doing micro, and we all owe gratitude to Dr. Blackwell for teaching us what he has. Dr. Knott is going to give you a tour of one of his operating rooms.
The head and neck service usually has 1 or 2 rooms in these ORs every day, and we are just finishing up one of our flaps. Here is the OR. Here is the team doing the micro and closing the ALT donor site.
We hope you have enjoyed taking a walk through our facilities here today with us. We know it's not the same as actually being there, but we hope that this gave you an opportunity to see what life might be like inside the walls of our fellowship. Thank you for interviewing with us. We hope you think highly of us.